Good morning, my name is Rindy Appleman. I'm a Maryville nurse practitioner student, and today I'm going to be assessing the abdomen. So I have a willing and able participant who is over the age of 18, so we'll get started. In the abdominal assessment, you first want to start with inspection, and you're looking for any skin color, you're looking for the contour, symmetry, surface motion, and any venous patterns. So her skin color is within normal limits. The contour is normal. They're symmetrical on both sides. I don't see any bulges or masses that are visually apparent, and there's no surface motion except for the rise and fall from her breathing. So I'm going to have her raise her head up, and I'm going to check for any abdominal masses and the muscle mass as well, and then if there wasn't any separation in her abdominal wall, so that's a normal finding. And then in the abdominal assessment, you would then want to go with auscultation, and so you're going to start I'm going to start in the right lower quadrant and listen for bowel sounds in each of the 4 abdominal quadrants. And I was able to hear that tinkling sound in all 4 quadrants. Ideally, you're supposed to listen for 2 minutes if you're thinking that there's a problem going on. And then you don't mark the bowel sounds as absent until you've listened in each quadrant for 5 minutes. And then you also want to listen to the arteries while you're auscultating the abdomen. And that's the aortic, the renal, iliac, and femoral arteries. Okay, and what you're listening to there is for any bruits, and I wasn't able to hear any. You can also listen over the liver and the spleen for any friction rubs. And then you'll move on to percussion, and so you want to percuss all 4 quadrants of the abdomen as well, and make sure you're hearing that timpani sound. And I was able to hear that. And then you'd move on to percussion of the liver size. And so you start by percussing an area of timpani, and you move up in the midclavicular line until you hear the timpani change to a dullness, which means you're over a major organ. Okay. And once you find that, you mark it. And then you percuss down until, again, that noise changes. And so you're finding your liver borders, and then you take this and you measure it. And hers is about 6 centimeters, which is a normal finding. You can also percuss for the spleen. You may hear splenic dullness at about the 6th or 9th intercostal space. And you can start at the 10th intercostal space. And then you also want to percuss for a gastric air bubble. And I don't hear anything there. So we'd move on at that point to light palpation, and you're just checking for muscle resistance, tenderness, or masses. Is there any tenderness?
No.
Okay, good. And then you'd move on to deep palpation of the 4 quadrants, and again you're feeling 4 masses or significant amount of pain. And then you can also palpate for the liver border. And it may or may not be palpable. And then you can also palpate for the spleen, which should not be palpable, as well as the kidneys, which also shouldn't be palpable. And they aren't on her, so that's a good sign. And then we can also palpate for the aortic pulsations. In her flat abdomen, I am able to feel that aortic pulsation. So you could also you could palpate for the bladder, but you want to make sure they empty their bladder beforehand. And then at this time I'd ask her to sit up, and I'll just see if there's any tenderness in her kidneys. Any tenderness there? Okay, good. And so that would conclude the abdominal assessment. Thank you.